following program contains mature subject matter. Viewer discretion is advised.
I'm one of those people that he abused. He did this to me.
The doctor in hot water for reportedly sexually abusing at least 100 women.
He would touch my...
Then raising the minimum wage by just $1 could lower the national suicide rate and save thousands of lives. Plus, would you hit the brakes if you had a skid mark partner? He leaves skid marks in my bed. Sometimes they're not dry. That's today. Patients trust their doctors with their health and often with their life. A UCLA gynecological oncologist allegedly violated that trust by reportedly sexually harassing or abusing at least 100 women. Take a look.
Dr. Heaps would touch my breasts inappropriately using his whole hand.
He would compliment my breasts.
He would touch my pelvic region in an inappropriate rubbing manner.
As I look back, it didn't feel like he was looking for lumps.
I feel embarrassed and shamed and a deep sadness that it went on for so long.
About 10 years ago, I started seeing Dr. Heaps because I've had breast cancer myself, so Dr. Heaps was touted as the best.
The first time I went to see Dr. Heaps, I was taken into his office. I was always led to believe that the high risk of cancer would be there if he didn't continue to monitor.
One of the things that Dr. Heaps said to me that still rings fear in me, I can do this ultrasound on you, 2 weeks later you can develop cancer and it'll be too late.
I was also told in one appointment that my breasts were perfect and I would not need to have an enhancement, which I had never inquired about.
During the vaginal ultrasounds, he would use the wand in a manner that I felt uncomfortable, but I trusted him. I like life. I didn't want to have cancer again.
This conduct began in the first year and continued until my very last appointment.
After that visit, it was fairly consistent with the abuse.
About 6 months ago, when I saw the news alert that Dr. Heaps had been arrested, I had an instant sense of all the blood rushing out of my body.
I'm one of those people that he abused. This is me. He did this to me.
And suddenly having to face all of those appointments, the comments, the inappropriate touching, and look at what had happened to me.
It just made me feel sick to my stomach.
And what causes me sometimes even more anger is how UCLA neglected to protect me and the other women as patients. There were numerous complaints, all of which I'm only just now learning about, but happened over the years that I was seeing Dr. Heaps.
This shouldn't have happened, and it should never happen again.
Ellen and Stephanie are both joining us today, along with their attorneys, Darren Kavanagh and Jennifer McGrath. I want to thank you both so much for being here. Darren, I want to ask you off the bat, currently there are both criminal and civil cases being brought?
Yeah, so there's criminal charges where the district attorney is trying to put him in prison for those 3 charges that you referenced. We're hopeful that the district attorney is ultimately going to file even more charges based on workup that's being done right now. And then separately, there are civil lawsuits where there are now about 100 women who have come forward filing claims. Jennifer and I represent more than 50 women against both Dr. Heaps and UCLA.
And when did the first reports about Dr. Heaps come out?
There was a Title IX investigation, which is UCLA's own internal review, which found that Dr. Heaps violated the sexual abuse and sexual harassment policies. Through those interviews, there was a doctor who described the medical board being in Dr. Heaps's office taking photographs between 1997 and 2000. And that was allegedly with respect to similar allegations.
So obviously that was many, many years
before
these claims have now become public.
Right.
So can you explain, or any thoughts about the long delay and all the women impacted in that interval?
Yeah, UCLA needs to answer and explain to the public and the community as to why these complaints went unheeded. We have clients who reported back in 2014, multiple times in 2017, and UCLA did not take any action. until the end of 2017.
And it seems like there was a financial incentive to do so. UCLA bought his practice in 2014. And there's actually a newspaper article that came out in 2016 about the highest earning employees in the University of California system. And he's on that list as one of the top earning staff. It's primarily athletic folks, coaches, athletic directors, and then a few doctors. And he's one of the top earning doctors. So it's not unthinkable that UCLA had a financial incentive to help sweep this under the rug. And frankly, our allegations is that they prioritized money over the health of women.
What are some of the things that Dr. Heaps allegedly did to other women?
We allege that there was conduct that was not medically necessary, that in fact it was conduct that was designed to sexually stimulate women, which we know is never part of a gynecological exam and should never be part of it. And that's something that UCLA has acknowledged in the Title IX report, which was recently released with regard to the misconduct alleged by one of our clients, and UCLA acknowledged that that type of behavior, sexually stimulating conduct, is, of course, not acceptable. And that's what numerous of these women allege.
Ellen and Stephanie, were there chaperones ever in the rooms for these exams?
In the past, before the incident, there were, but there came a time where there was no longer chaperones in the room, which shocked me as well. You look shocked. I was shocked as well.
I'm just thinking that just, male OBGYN, I thought that was now at least the standard of care.
Any OBGYN, I would think. Nita, I mean, this is so unusual.
Yeah, it is my preference personally, even as a female, to have a chaperone in the room. And honestly, in some clinics where it's very busy, I do have, I do know some of my female colleagues may ask a patient if they feel comfortable proceeding without a chaperone, but you should always leave that up to the patient. But I don't even ask the patient. I just think it's good form to have a chaperone in the room.
But a male gynecologist?
Yes.
I mean,
That's what I'm
any male physician. As a plastic surgeon, I would never go in and see a woman and examine a woman without.
I mean, I don't even do full body skin checks in my office without a medical assistant present. It just seems that now that's so much the standard of care.
When there were chaperones present, there weren't always. I feel that I was misinformed. They appeared to be more as assistants. They handed him tools. They would input things on the computer. They'd have their back to he and I during the exam. I didn't quite understand their role as a chaperone. I had thought they were just his assistant, and that's why sometimes they were there and sometimes they were not. If he didn't need somebody in the room, he didn't have them.
That's actually one of the systemic changes that we're hopeful will come out of all this, is that we'll see independent chaperones, people who aren't beholden to the doctor for raises and reviews. And it really was an unfortunate culture that existed or appears to have existed at UCLA.
What other changes do you hope will come out of this?
Well, we would like to make sure that UCLA and other large health systems and institutions also have very clear reporting mechanisms. It doesn't appear in our investigation with our clients that either the patients themselves or the staff members at UCLA really knew what to do if they became aware of misconduct or experienced it. We have a client who is actually a current UCLA health employee. She went to Dr. Heaps for treatment just as a patient, and then subsequently reported immediately after that she had suffered alleged abuse, and she reported that to her supervisor. And the supervisor essentially told her that she had misunderstood and that she needed to go back to work and be quiet about it. So clearly the reporting mechanisms are not in place as needed at UCLA and probably at other institutions, unfortunately.
How has Dr. Heaps responded to these allegations?
Well, obviously, because of the criminal case, he hasn't responded much yet, although what we're hearing, frankly, is that these women just don't understand that what he was doing was medically appropriate. And the idea that women just wouldn't understand what is sexual stimulation and obvious inappropriate behavior is, frankly, it's insulting.
As an OBGYN, of course, I have thousands and thousands of colleagues who would never violate a patient. And we never want a patient to feel like they are in an unsafe environment, because it's a very vulnerable position. It's a very vulnerable position when you're doing that exam. So An OBGYN should never be commenting on the attractiveness of your breasts. They should never be inserting ungloved fingers. They should never refuse to have a chaperone in the room. There should be no sexual innuendos. You should always feel as though you are in a safe, secure environment. If for any reason you don't feel safe during an exam, you stop that exam. If you don't feel safe during an exam, you report that situation to someone, because not only does it need to be addressed in your case, but you're also speaking up for the many, many women who may say, did anything really happen? Or even the women who will be seen after you. So make sure you speak up. You deserve to feel safe.
I'm so disappointed to hear that they had these reports for years before any action was taken.
And we did reach out to UCLA for a statement. The following is an excerpt from UCLA Health statement. We are deeply sorry that a former member of our staff violated the trust of his patients. We recognize that we must do more to provide the safe, supportive, and respectful environment. We initiated an independent review of our institution's response to sexual misconduct in clinical settings. That process will be guided by the principles of transparency, accountability, fairness, and devotion to our patients. You can find that full statement on our website, thedoctorstv.com. Ellen and Stephanie, I want to thank you for sharing your story here with us today. And Darren, Jennifer, thank you also for being here. And we'll have more about this case on our website as well, more after the break. Coming up, we've all heard the saying, money can't buy happiness, but there may be more to consider. Raising the minimum wage by just $1 could lower the national suicide rate. Then,
She is letting that man in her bed. That must be some good sex. I've never had that kind of sex before.
that's coming up. We've all heard the saying, money can't buy happiness, but new research is suggesting there may be more to consider. A new study published in the Journal of Epidemiology and Community Health suggests raising the minimum wage by just $1 could lower the national suicide rate and save thousands of lives. And when you think about the federal minimum wage is $7.25 an hour. There are some states, of course, where that is higher. And when looking at this minimum wage, it's quite remarkable. Raising it by $1 lowered suicide rates by 3.5 to 6%. That equates to 27,000 lives, if not more. And it makes sense.
Yeah.
I mean, it makes sense that if you're struggling to get by, and you're in despair, and you have no economic stability, and also dealing with any other problems in the household, that increases suicide rates.
Well,
so
it's
a little
such
bit more money can help.
Yeah, you into a depression, and what is the end point of the worst type of depression you can have is committing suicide. So it does make sense. And you know, you led off by saying money can't buy happiness, but you're talking about money just for the basic needs to live in a decent place and be able to get regular meals and
To not be in despair.
yes.
They're sad and they're depressed, and it's hard.
Look, minimum wages should be different state to state because there are some states where the cost of living is much lower, but $7.25 just, it seems a little bit anachronistic. And if you could raise it by $1 and see this drastic decrease in suicide rates, economic stability for families is also so very important when you start talking about kids.
More likely to have a less stable home environment, more likely to develop a substance abuse, especially if you're depressed. So it's sort of a vicious cycle that's created. You know, interesting enough, part of the study that college graduates did not play into the study. It didn't affect the rates. So I guess we can extrapolate that the more education you get, the better. Better chance of earning more and having a better livelihood. So whatever it takes for you to get more education beyond high school is valuable.
Well, the one thing that I will say, the amount of income inequality has gotten a little bit out of control in terms of, well, just in terms of if you look at the top 20 people in this country and how much they're worth, it is so astounding. And And it's hard not to look at some of these people, and we've even talked about it in hospitals in America, where you find out that maybe a CEO of a hospital-based company makes $10, $15 million, and then, you know, maybe the individual that's making sure that hospital is clean and safe for surgeries is making $7.25 an hour. You know, it's hard, regardless of your politics, to not think that, you know, maybe that person in the ivory tower and making $15+ million, that maybe, you know, maybe we could hike by $1 the amount that someone is making.
I mean, yes. I mean, looking at that hospital model, that guy,
It's a pretty
that
classic
person
model.
that has to keep it running, whatever it is, whether it's keeping the linens clean, keeping the place clean, whatever, is as important part as that CEO.
Everybody's a part of the team, but you know, hopefully things will change. You know, we always hope that, but in the interim, we know that chronic stress is hard, but we never want anybody to kill themselves because they are stressed. Make sure you're talking to a healthcare provider. Make sure that you're reaching out to someone to try to get help to get you in a better situation. Or if it is something financial, maybe they can let you know about different resources that can help you out, whether it's buying food, whether it's getting your medicine, whether it's getting childcare for your children, whatever it is. But there is definitely always a better answer than suicide, so please reach out.
And if you do make that minimum wage, you actually, if people are out there and they don't understand the tax world, you can actually get an earned income tax credit. So there's actually a way to increase how much your take home is. And there are a lot of people out there, they've done studies where people don't actually get the credits that they're allotted because maybe they don't understand all of that. So look, no easy answer here, but you can't deny the facts. If raising it $1 could prevent 27,000 deaths, you have to ask yourself, is that money well spent? I would argue it is. We'll be right back. Coming up.
She is letting that man in her bed. That must be some good sex. I've never had that kind of sex before.
Then.
When many of us enter that phase of life where we're looking to conceive and we're ready for that baby, there's a huge gap in information. And I'm a physician, and there were a lot of misconceptions.
That's coming up.
The following program contains mature subject matter. Viewer discretion is advised.
Would you hit the brakes if you had a skid mark partner? Let me explain. A 24-year-old woman recently asked Reddit for relationship advice about her 29-year-old boyfriend and his habit of not wiping very well after using the bathroom. She wrote, to sum it up, he leaves skid marks in my bed when we are together. Sometimes they're not dry. I find them after he leaves, and because I have light sheets, it's kind of obvious. I really need to talk to him about this, and I don't want him to feel bad. What should I do?
Skid marks on the sheets.
Skid marks. Oh.
That's wrong right there.
Yeah, to say the least. I mean, well, I want to commend her for caring about his feelings, but she is letting that man in her bed. That must be some good sex. I've never had that kind of sex before.
Doctor, I couldn't have put it better.
I'm just saying. Now, if you have a medical issue, you have to talk to your partner, and y'all can work together to come up with a solution, but she said she put her hand down and it was wet once.
Oh, I am disgusted by this whole topic. First of all, the first thing you need to say is, please wear some drawers while we sleep at night. I mean, no one should be sleeping buck naked if you're leaving skid marks. Having said that, he could have an incompetent anal sphincter.
You gotta tell people that. You gotta talk about that kind of stuff.
29 years old,
He may not know.
that's a long shot.
Well, you can have, you know, he might have a big hemorrhoid down there. You know? You can have a big hemorrhoid
Why
right
are
at
you
the
defending this dude? You know what?
This Reddit user was actually my wife, Drew. It's me. I'm kidding.
Well, how about helpful hint?
You're gonna get in trouble for that one.
Maybe some wet
I know.
wipes next to put as a
By the toilet.
If you're in a relationship with this person
next to the bed?
No,
How about just
next
wear
to-
some
in the-
boxers?
in the bathroom. If he's not wiping properly, maybe he has
But I think they-
loose stools. He's not.
There's
From my
a leaking
understanding-
problem going on here. The only way you leave skid marks consistently like that is if you have a bit of a leakage problem. And I'm not trying to get too serious here, but I've taken care of plenty of people who've had problems. And when you have leakage, you have to take extra steps because one of the toughest things to deal with is relationships, intimacy, and it can happen. But the first thing you do not do, if you notice, and it could be just because you have a big hemorrhoid. You have a big hemorrhoid there, the sphincter doesn't close perfectly. It can kind of leak. First of all, you have to wear. Wear something.
That's a theory.
Wear a
I mean,
diaper. Somebody said a diaper.
If
Not a
this
bad
guy
idea.
is worth the effort,
Yeah.
it's all about communication.
Yeah, just
Talk
communicate.
to the guy.
But I love that she is so
You
sensitive.
grab him by the hand,
Bella.
walk in, look at the sheets, and go, "Did you do that?" Bad. Did you do that?
I mean-
well, you and I are gonna have a little talk.
I love it, but you
like
know, if that guy, Bella, if you are watching, this woman loves you. Like you have a good one.
One of my problems when we talk about these topics, I don't know if it's just me or if anyone else is like this, but I can actually start to smell it.
Nope.
Right?
I can't.
And it's a problem.
You smell it?
I don't like that I can, but it's,
That's weird.
We'll be right back. Coming up.
When many of us enter that phase of life where we're looking to conceive and we're ready for that baby, there's a huge gap in information. And I'm a physician, and there were a lot of misconceptions.
Then, some parents save their kids' baby teeth for the tooth fairy, but what if those same teeth could help in detecting trauma? That's coming up.
If you're trying to conceive a baby, there's a lot of bad information. It gets very confusing. Well, one company is looking to change that. And joining us today are the co-founders of Natalist, practicing OBGYN Dr. Nazanin Homafar and Chief Scientific Officer Dr. Elizabeth Kane. Welcome. So, Liz, tell us, what's the goal of Natalist?
So the goal of Natalist is to really guide people on their path to have a child. And Natalist does this by offering education-based conception essentials. And when we founded Natalist, we really looked into it and found that only 1 in 6 women will go for what's called a preconception visit. And this is a visit where you would go meet with your doctor before trying to conceive and look for any roadblocks that might happen on the way and really just find out, hey, how do I actually go about getting pregnant? And, you know, most people don't even know that they need to go for this visit. So there's this information gap out there right now that Natalist is trying to bridge by working with doctors like Dr. Naz and scientists like myself.
I see patients all the time who are trying to get pregnant, and we have to acknowledge this is a major milestone when you finally decide that you want to start trying to get pregnant. There's a lot of information out there, and people are going to the internet trying to get more information. We each, Dr. Liz, Hallie Tecco, our other co-founder, myself, we each had our own path to becoming mothers that had its own bumps, and we realized in the process that we really want to help improve this journey for others.
And I think as a young woman, I spent a lot of time and effort trying to figure out how not to get pregnant.
Yes.
But when many of us sort of enter that phase of life where they're looking, where we're looking to conceive and we're ready for that baby, there's a huge gap in information. And I'm a physician, and there were a lot of misconceptions, and I didn't necessarily have all the background that you guys are offering.
And that's where the preconception visit comes in, because at that visit, your provider will do a complete physical exam. They'll talk about your family history, your personal history. They'll try to make sure that you're going to be as healthy as possible before you conceive. They will try to see if there are any things that may come up during your pregnancy. So like speaking to you and your significant other and looking for a potential reason that might make them say, oh, do you want to do some genetic screening, or just any of those things, identifying any of those potential issues before you're actually pregnant. That's always going to be an ideal situation.
We're going to take advantage of your expertise today. Today we're going to play a game of myth or reality, the OBGYN edition. Are you ready?
You're so ready.
Nita, you have an unfair advantage.
I
in
do.
this one.
I do have a bit of an
You're
unfair
probably going
advantage.
to be pretty good at this.
I
right?
better be.
All right, how it's going to work. We're going to state a claim. The audience will vote, and then Dr. Naz and Dr. Liz are going to set the record straight. So first up, putting your legs up after sex improves your chances of conceiving. Audience, get out your tablets, and we want to hear what you think about putting those legs up in the air. Press yes if you think this is reality, or no if you think it's a myth.
I like the visual, right? Your legs up in the air.
But I think Kim Kardashian posted about this, right? Wasn't this a big
Yes.
thing on social media?
All right, did we
We'll
vote?
see.
All right, the results are in. 40% say yes and 60% say no. So the majority thinks that it's a myth. So Dr. Naz, we're going to let you take this one. What's the correct answer?
The correct answer is that this is a myth. Well done, audience. So while putting your legs up in the air is a great restorative yoga pose to stretch with,
Hard.
Leave it at
Or
that.
it could be fun,
It'll
whatever.
be fun. It's not going to help you get pregnant faster. And while we're at it, let's talk about the fact that there's no sex position that will help you get pregnant faster. I tell my patients that 80% of couples will get pregnant within 6 months of trying. That's a lot of sex that you have to have sometimes, and it's not always fun. And sometimes it gets a little redundant. So get creative, do what you want to do. As long as you're having vaginal intercourse, you're having the right kind of sex.
All
All
right.
right.
Sounds good to me. All right. Next up, birth control cleanses help restart your cycle after stopping hormonal contraception, making it easier to conceive. All right, audience, you're on the spot one
Wait,
more
just
time.
just to clarify, is this a cleanse that you do like from your diet, or are we talking about drinking juices? Like I just trying to, so I'm a type
Good
A.
question.
I want to know
Good
what
question.
we're talking
So,
about before we vote.
Dr. Nita will explain. It actually is a cleanse
Yes.
that you drink.
Yes. So, you want to come off your birth control to cleanse or not to cleanse? That is the question.
So you would purchase this online or at a store or wherever,
Yeah.
and then you would drink it. And
Yes.
the idea
Yeah,
is
there's-
it resets your hormones.
There are
somehow?
different versions of them. Some are supplements, some are juices, but all the variations you mentioned
dietary
exist.
cleanse.
Yes.
Yeah.
Okay.
Something oral.
Yes.
Yes.
All right, we're going to let the audience vote. Vote yes if you think that birth control cleanses work, and vote no if you think it's a myth. So do you stop the birth control pills, or do you just do the cleanse?
Yeah, so that's the point. They're saying once you stop birth control, they're saying, oh my gosh, I stopped this birth control. I've been on birth control for a while. Now I need to cleanse my body. I want to get the hormones out. I want to reset everything. And the thought is they'll go out and get one of these supplements to try to achieve that goal.
All right, so the results are in. 44% of you said yes, 56% of you said no.
Pretty close.
Yeah.
So
pretty close.
it's pretty close,
Even
but
split.
they say it's a myth. What do you say?
We have a very savvy audience.
Well,
It
they watch the
is-
doctors.
Yeah, it's true. It's a myth. So good job, everyone. Yeah. Yeah, I mean, there's no data to support that taking these supplements or juices or any variation of a birth control cleanse will help your body restart its menstrual cycle in any way, or that it will help you get pregnant faster. So we always say, save your money and just throw away the birth control pills and go away and try to get pregnant the old-fashioned way.
Yeah, I mean, this seems
Good
like
answer.
savvy marketing. That's all, right?
The only thing you need, take your prenatal vitamins with folic acid.
Sure.
Yeah.
But no cleanse
Yes.
needed.
All right, one more. Last up. A woman can tell if she's ovulating by examining her cervical mucus. All right, audience, this gets a little tougher. Vote yes if you think this is reality, or no if you think this is a myth.
I'll be impressed if you get this one right.
Yeah, they're thinking.
This one is harder.
This one's harder.
All right, wow, we are
50-50.
split down the
Even
middle.
split.
This is 50%. Dr. Naz,
This is a reality. This is true. So let's talk about the different ways that you can test for ovulation at home. Cervical mucus is one of those ways. So cervical mucus, or some people refer to it as vaginal discharge, changes in color, in quantity, in texture, depending on where you are in your menstrual cycle. And the amazing thing about our bodies is that when we get close to ovulation, so when our ovaries release a mature egg that could be fertilized by sperm, our vaginal discharge changes. It becomes clear, it becomes very thin, almost like an egg white texture. And this actually helps sperm better reach that egg in the fallopian tube. So amazing way that our bodies work. If you're someone that wants to use the cervical mucus method, you can start paying attention to your vaginal discharge, keeping track of what it looks like, and then planning on trying to conceive in your fertile window. So that fertile window is really important. It's the 5 days before you ovulate and the day of ovulation, and that's when we want you to have sex if you're trying to get pregnant. The other way that you can test ovulation at home is by using an ovulation kit, which uses a hormone. It's looking for a surge in luteinizing hormone to see when ovulation is going to be triggered.
So that's an easy way. The ovulation predictor kit is the one, the test you can just grab off the shelf and use at home.
Yes, and Natalist actually provides ovulation tests on our site. It's one of the evidence-based way that most doctors recommend that patients use.
So go to your website for that information to help you get pregnant.
Yeah.
Right? Dr. Liz, Dr. Naz, thank you so much. Great information, great answers.
I wish your website had been available when we were trying. Thank you.
We'll be right back.
Coming up, some parents save their kids' baby teeth for the tooth fairy, but what if those same teeth could help in detecting trauma? Then, a couple of handfuls of nuts may improve the male orgasm. That's coming up. Some parents save their kids' baby teeth for the tooth fairy, but what if those same teeth could help in detecting trauma? A recent study out of Mass General reveals how crucial moments in a child's history are often recorded in their teeth. And this is really coming down to these microscopic markings within children's teeth. Much like you'll think of those markings on a tree as they age, maybe this is a tool for detecting trauma. And obviously this is all new. We're learning a lot about it. A lot of things obviously cause stress in childhood. I am fascinated by this. I think that we have all of these potential new tools, investigative tools. I, right now, don't know what to make of this. So what we should do now is have a dental expert
who knows the embryology
reconstructive
of the
and
teeth.
cosmetic dentist Dr. Joe Willardson joins us now to weigh in on this study. Have teeth ever been used in this way in the past?
Yeah, so here's the thing. We've always known that certain drugs, different diseases, like syphilis, bacteria, Hutchinson's, that's right. Yeah, that's right. Hutchinson's incisors, viruses, those have always been clues into what's going on with the development of the teeth, both prenatal and postnatal in that young age. So the thing that's interesting about this is we've never really looked at mental stress. So this is what makes this study very interesting. And who knows where it's going to go from here,
Well, and let's talk about that. What would cause these quote-unquote stress cracks? What is it? Do we understand why if a child goes through a lot of emotional trauma or stress, why these stress cracks develop?
I get that question a lot from different patients, concerned parents. They'll see fractures in the enamel. All the time, a patient will go look in their rearview mirror with the sunlight on it and see these fractures and they get alarmed. That's normal. What's not normal is when you start having large pieces of teeth fall off or multiple cracks due to parafunctional habits, which can be related to stress.
Dr. Willardson, do you think this is going to be a practical screening tool? So I think, you have to wait, for the kid's tooth to fall out however many years
And then
later.
you analyze
then you
it
analyze
under the
it,
microscope.
and then you say, okay, maybe this child should be screened for mental health issues. Like, I'm just trying to think about logistically and practically how this would
Before
play
the
out.
tooth fairy comes, you got to look at it under the microscope.
Take it to the dentist, have it checked.
You have a really good point. How practical is this going to be? Because there's not really any general dentist that's going to be able to dissect the tooth, recognize these rings, and do something about it. I think it would be very difficult for a dentist to take these signs at this point and make any sort of label.
It reminds me of a lot of new developments in medicine. Just because you can do something doesn't mean you always should. And another example might even be genetic testing. A lot of people, they want to have all of their genes tested, find out as much as possible. I think back to when we were first uncovering these cheaper genetic tests, and I said, well, I don't necessarily want to know if I'm at a higher risk of having a heart attack. I'm just going to live my life in such a way that I will decrease my risk for heart attack. With kids, I mean, we would like to believe that if they're exposed to emotional stressors, we're working on those stressors while they're happening rather than once their teeth come out 5 years later, it's like, oh my gosh, boy, you've been through a lot. Woo. So that, to the practicality of this, it seems more scientifically interesting than maybe pragmatic in a clinical setting.
Yeah, I think you're right. I think one of the really interesting things is the power that stress has on the physical body. Great point. The tooth is the hardest substance in the body. We can only imagine what stress is doing to other organs and soft tissue.
Well, and you can tell, I mean, when you look at adults, you get a pretty good read of a lot of things that are going on with them medically and just habits. You know, what they eat, what they drink. Do they grind their teeth? Is the grinding related to stress? I mean, I think the teeth.
Yeah.
Here's the one thing I will say. I'm gonna give a shout out to the dentistry world. The one thing that we do know is if you keep the teeth clean, you keep good oral health, that is great for your overall health. And who knows, there are all these weird connections out there with the gut microbiome and mental health. And so we may not know what to do with these stress lines, but we do know that a good oral hygiene is key to good overall health. Dr. Joe, thanks so much.
Thank you.
Thank you.
We'll be right back. Coming up, a couple of handfuls of nuts may improve the male orgasm. Then, feeling fatigued and looking to boost your recovery after a hard workout? We have a doctor's shot of health to help. That's in today's Doctor's Prescription. That's coming up. Hercules, Hercules, this just in. Eating a handful of nuts may improve your orgasm, Drew! Woo-hoo! Yeah! Two handfuls of nuts.
Why do you think I have a bowl of nuts on my nightstand, buddy?
Have a couple handfuls, Drew, as I explain. According to a study published in the Journal of Nutrients, yes, a couple of handfuls of nuts may improve the male orgasm.
What about women?
All nuts.
No, just men.
Probably good for you too, I'm guessing.
It was just the study was for men, but I mean.
Well, we can start our own study. Go ahead.
Just in case.
You can try it out. But hey, what I love about this study is that when you look at healthy foods, which we talked about already in this show, about how foods can have so many health benefits for you, we often forget about the potential sexual health benefit. And in this particular study, they did. They looked at blood and sperm samples of these study participants who were eating the handfuls of nuts, and they found that those who added nuts increased orgasmic function, increased sexual desire. Hey, who am I to argue?
But no difference in erectile function, intercourse, and overall satisfaction.
What? Wasn't there one flaw with the study? It was sponsored by the
100%, Drew.
The nut growers.
It was 100%. This study was funded by industry. But nuts, I'm telling you, one of the best snacks that you can eat. And I am fine. Look, this is a tenuous study, okay? I get it. But I can tell you this. Yeah. I've looked at the studies on nuts, long-term studies of decrease in overall mortality, decrease in cardiovascular events, and we know an improved cardiovascular system can very well improve your sexual function, blood flow down there, and heck, if you have better sexual function, I would be willing to bet your orgasm is better as well.
It's those peanuts. You made me eat those nuts.
We have a doctor's shot of health to help. All right, I have this concoction. Docs have a sip. They do not know what is in this.
Cheers.
4 ingredients.
Cheers.
I'm so bad at guessing.
That was a hell of a workout, you two.
Each ingredient has a purpose. not only in adding taste, but in muscle recovery.
I'm so bad at this.
I taste ginger for sure.
Ginger, I agree.
There is ginger. Now that you mention it.
It does have ginger. Good job. Ginger, anti-inflammatory, great. Love that one. Okay.
Orange?
No.
Almost tastes like.
Pomegranate?
Isn't it tasty?
Pomegranate?
Pomegranate?
No pomegranate.
How about strawberry?
No strawberry.
Cranberry.
Or maybe it's turmeric.
And I gotta tell you, the reason that it's the combination of ingredients is gonna fool you all.
Turmeric, lemon.
You guys, okay,
I
I'm
think
gonna.
there's some coconut in here too, isn't there?
Pineapple.
So it's pineapple juice combined with tart cherry juice. That's why that combo together, it's almost like you're combining the tart cherry juice combines with the pineapple juice to taste lovely. But the bromelain in the pineapple juice, another great anti-inflammatory, and we all know tart cherry juice is great after workouts, but when you combine it with the pineapple juice, isn't it a really nice,
It's nice.
balanced
It is
flavor?
fun.
Yeah.
And then
But not
cinnamon
too
is
tart.
known to balance your insulin levels, your blood glucose levels, so it's a perfect drink. Cheers, Doc.
Good workout.
Cheers.
Great show, and of
Great
course,
show, you all.
we're gonna have the full recipe and anything you may have missed on today's episode at thedoctorstv.com. See you next time.
Yeah.